Hello, I'm Dr. John Benedict-Cabaño, board certified in family practice, specializing in no needle, no scalpel vasectomy. Congratulations, you have chosen the safest form of permanent contraception available. Most patients find the procedure more simple and more gentle than they anticipated. The purpose of this video is to illustrate how a vasectomy is performed and what you need to know prior to your procedure. To start, let's get a general picture of the anatomy.
The first image is a cross-section of the male pelvis. We have outlined the bladder in blue and the prostate in orange. Urine that's stored in the bladder flows out through the prostate and down when urinating. Ejaculate fluid flowing in from behind flows through the prostate and also down. The bladder neck tightens during ejaculation so that everything flows out properly and doesn't back up into the bladder. Behind the bladder are seminal vesicles, which, along with the prostate, produce over 95% of your semen. When you get a vasectomy, all that's missing afterward is the 2 to 5% of the semen that's actually sperm. Sperm are made in the testes and flow continuously up through each tube, called the vas deferens or the sperm highway. Many are stored in the dilated portions of the vas behind the bladder, and they combine with fluid released by the seminal vesicles at the prostate at the time of ejaculation. The easiest place to interrupt the flow of sperm is about an inch above each testis, where the vas tubes are just beneath the skin and very mobile.
There are two ways to anesthetize the vas deferens, and there are two ways to block them. When the anesthetic is injected, the patient can feel a momentary sensation like the testis is gently being squeezed.
The second way to anesthetize the vas tubes and overlying skin is to pop a thin stream of anesthetic solution through the skin and around each vas. This is done by using a pressure spray applicator, no needles. Some men feel nothing. Some say it feels like the snap of a small rubber band. The jet applicator provides complete anesthetic for most men. For some, the thickness of the scrotal skin and the size of the vas deferens may require additional anesthetic injected with a needle. But since there's already partial numbing of the area, most men don't feel this supplementation with the needle at all.
Okay, now there are two ways to access and block the vas deferens.
One way to access and block the vas deferens is the traditional method. We make one central or two lateral incisions in the scrotum with a scalpel and then use sutures to close the incisions. The second way to access the vas tubes is what we call the no scalpel technique. This method uses a very pointy hemostat tool to puncture the numb scrotal skin. Then we stretch a small single opening in the anesthetized skin right in the area in front of the scrotum and use a special ring clamp to bring out the vas so it can be blocked under direct vision. Once a small section of the vas is lifted through the skin, we cauterize the inner lumen of one end of the vas deferens prior to dividing them, blocking the passage of sperm. In addition, we lift one end of the vas outside the little fatty sheath that surrounds it, leaving one end inside the sheath, and then placing a small titanium hemoclip on the sheath to cover the other end. This helps lower the risk of both ends reconnecting again. Then we inspect for any bleeding blood vessels and ligate if necessary before we gently place the structures back into the scrotal sac.
The whole procedure takes about 20 to 30 minutes. The patient is lying comfortably for the whole time. For anesthesia, my preference is to use the spray applicator. It is simpler and provides a more comfortable experience for our patients. For access, we prefer the no scalpel technique. It is simpler, less invasive, and provides a faster recovery time. The two common risks after a vasectomy is a hematoma and an exaggerated inflammatory response.
During the vasectomy, the tiny blood vessels alongside each vas can be temporarily weakened. If within a day or two of the vasectomy there is any downward pull on those weakened vessels, even by the weight of the testicles, or if the pressure in the vessels is increased by lifting or trauma, the vessels could break, ooze, or develop a hematoma. A hematoma is a collection of blood outside the blood vessels, and it could keep you quite tender for almost 3 to 6 weeks. To avoid this, it is best to use a scrotal support or tight, firm underwear for 3 to 5 days after. Remain reclined on the evening after your vasectomy. Limit yourself to light activity the next day, and refrain from working out or strenuous activities for a week. You may resume gentle sexual interaction 5 to 7 days after your vasectomy, but this of course largely depends on your comfort level and healing time. The second most common issue after vasectomy is exaggerated inflammation. After vasectomies, white blood cells in the normal testicular circulation ingest, digest, and recycle the sperm that cannot exit in the usual way. This is a normal process and can cause inflammation that most men do not even notice. A few men will develop swelling and discomfort, usually on one side, anytime several days or even weeks after the vasectomy. This is probably an exaggerated form of the normal inflammation needed to recycle the sperm that cannot exit the traditional way. It usually responds nicely to an anti-inflammatory medicine like ibuprofen and rest. It is temporary.
Now this is very important because downstream, the vas deferens is still full of sperm, so your semen may not be free of sperm for many weeks after your procedure.
We microscopically examine semen samples after 12 weeks and 20 ejaculations after the vasectomy to see if you are considered sterile. Even then, 5% of men will still have some sperm in the semen, requiring another check in 2 to 4 weeks. Sometimes sperm linger for months after a vasectomy, so do not consider a vasectomy effective until you are told that there are no sperm in your semen. We will provide instructions on how to get your semen checked. There are other rare risks after vasectomy, such as infection, persistent inflammation, sperm granuloma, prolonged pain, and sterilization failure.
Finally, I would like to emphasize that a vasectomy is a permanent, non-reversible birth control. Now, some can be reversed, but not all. In general, vasectomy should be considered permanent.
There are many truly reversible contraception alternatives to vasectomy, like hormonal birth control for your partner, the intrauterine device or IUD for your partner, spermicides in the form of vaginal sponges, creams, foams, films, and barrier methods like condoms and diaphragms. If you fail to apply a condom or your partner fails to insert a diaphragm, emergency contraception or the morning after pill can be taken by your partner for up to 72 hours after intercourse to prevent pregnancy. We must remind you that vasectomy does not protect against sexually transmitted infections, and you should continue to wear protection if indicated. Also note that vasectomy is less invasive than female permanent sterilization, also called bilateral tubal ligation. A tubal ligation entails placing a patient on general anesthesia and opening up the abdomen. Because of this, the less invasive vasectomy has gained significant popularity.
Every man should understand and rule out all these alternatives prior to getting a vasectomy if there is any chance that someday they would want more children.
Sperm storage is also available as an insurance policy against a major social or family change in the future. Stored sperm may enable the vasectomy patient to father children in the future without undergoing a reversal operation. But use of stored sperm is not always viable, and there are both initial and yearly storage fees associated with this. Please refer to our website for more information.
Congratulations again for choosing to get a vasectomy, the safest form of permanent contraception. Most men are amazed on how easy and painless the procedure really is. When you are done having children, vasectomy is an excellent choice. Thank you, and we look forward to seeing you at the Vasectomy Center.